In line with the state government initiative on health insurance, the Niger State Head of Service, Alhaji Abubakar Sadiq Idris, has directed civil servants in the state to enroll and register with Niger State Contributory Health Agency, NICARE, to enhance productivity and also to enable them and their families have access to quality healthcare service delivery. He gave the advice while inspecting some of the facility providing night care service at primary healthcare Bosu Locals and Tunga in Mina, the state capital. The report.
The Niger State Head of Service, Alhaji Abubakar Sadiq Idris, urged all stakeholders, particularly within the civil service, to see health insurance not as a government imposition, but as a collective responsibility that ensure access to affordable and efficient health care for all.
For what I've seen here, I think it's a very beautiful start, and I encourage all people, whether they are civil servant or even in the private sector, to join. Because definitely from food, the next thing is wealthy to your well-being, and it's not all the time you have the funds for medical care, but you can save for it, and that is where you need the medical care to ensure that you can access facility and medication, even when you don't have money at the time, you don't have the doctor. So what I've seen here is very excellent. They are doing very well, but there's room for improvement.
Leading the team on inspection, on the monitoring and evaluation, the Executive Secretary of Niger State Contributory Health Agency, NICARE, Suleiman Abubakar, warned health facility under the scheme hacking service denier, untimely attention, and incomplete service delivery to its enrollees.
We are just implementing what we are supposed to do as part of our efforts. Like I said, that we have gotten adequate support from His Excellency Former Governor Muhammad Umaru Babu. And one thing that he has always encouraged us is to have collaboration with the Nigerian Labour Congress, organized labor, and also other agencies and ministries to see how we can collaborate to ensure that NICARE is adequately and people are adequately sensitized and informed about what we're doing at NICARE. So what we're doing today, we're doing our quarterly quality assurance and M&E visitation. So what we do is every quarter we visit facilities, at least 25% of our facilities. The idea is that we have 4 quarters in a year. So if you visit, you pick 25 facilities, different facilities each quarter, you'll be able to visit all your facilities in 1 year. So for this assessment, we're visiting 105 facilities to ensure that they still practice what is agreed in our SNA in Nigeria. Our enrollees get adequate value for money to ensure that the environment is clean and ensure that most people, enrollees know their rights, they have drugs, and also correct them if there are places that they are lapsing. So hence why we have the head of service, we have the Honorable Commissioner of Transport, we have the organized labor here with us to see how we can also collaborate. Like we all know, we're also in discussion with labor to see how we can have all the formal, the civil servants on board.
Suleiman Abubakar maintained that NICARE is committed to providing quality, equitable, and affordable health care to all Nigerians irrespective of financial status. The Executive Secretary of NICARE said they have gotten adequate support from the Governor Muhammad Umar Bagu, saying that their visits to the facilities is to ensure that the enrollees have benefit for their money.
So far so good. I'm impressed with that. But like I said, most times we don't need just quarterly assurance for this. It needs is a constant, continuous engagement. You can live here today, I'll be feeling fulfilled, and maybe later I'll receive a complaint like that. But what we've identified, and from the advice the head of service and the NLC have given us, is there need to be that synergy, a proper way so that we have our grievance redress mechanism. We talked about having a Sabicom board here, table here. We talked about having a way we can monitor the station so that we receive this complaint and we nip them in the board. Then the most important thing is proper collaboration with the Minister of Primary Health Care, the local government, to ensure that the staff, it's not about pulling human resource, it's about also training them.
The chairman, Nigeria Labour Congress, NLC, Niger State Council, Comrade Idris Abdulkarim Lapene, called for adequate supervision of health facilities, training of health workers, and also provision of modern equipment in all the health facilities in the state. The inspection of the facility provided NICARE service has the entourage of head of service, Niger State Commissioner of Transport, NLC, and TUC leaders, among others.
We have given out conditions for the civil servant to join, and part of those conditions is the facility tour. Let us be sure that yes, we have enough facility that will cater for this program, and then the intervention will go a long way to help even people that are not civil servants. So of course, we are here to see for ourselves and then advise our members on what is feasible.
Ahmad Yusuf reporting for NSTV News.